Hello everyone, welcome to From London with Love, with me, Lean Clive on ALB UK TV. Well, today our episode is very special and it's for every lady. If you are thinking of getting pregnant or if you just recently had a baby, this episode is for you. Today we have Dr. Nadia, specialist, to talk with us about mental health. Hello, Dr. Nadia.
Hello, Lynn.
Hi, it's very nice to meet you.
Thanks for having me. Thank you so much.
Very welcome. Dr. Nadia, you've been with us before,
Yeah.
but today's topic is different. Firstly, I would like you to introduce yourself for audience who seeing us first time.
Yes, thanks, Lynn. I'm an obs and gynae surgeon and fellow of the Royal College of Obstetricians and Gynecologists. I've been working in NHS hospitals, university hospitals for more than 20 years. And in the last few years, I've been working in a private sector clinic as aesthetic gynecology consultant as well.
So we have just the right person today. I know the topic is a bit different from what we talked about in the past, but today we are trying to raise awareness about mental health and especially about depression after giving birth. So Dr. Nadia, could you tell us a little bit more about what is the depression after giving birth?
We'll start from the beginning. Giving birth and having a new baby in the house is a big event for the mothers. You expect that they will feel happy and joyful, but for some other mothers, the situation is different. They could experience negative feelings like sadness and anxiety and depression. So these negative feelings ranging between mild mood changes, that's overly called baby blues, to a more complex forms that categorically classified as mental health illnesses, like a postpartum depression, which happens 15%, or puerperal psychosis. That's rare, thanks God, but it prompts immediate seeking of medical help.
If we are talking about the causes here.
So, yes, thank you. For the baby blues, it's not an illness. It affects 80% of mothers.
So is it just a changing in mood?
Exactly, it's very mild. It occurs few days after giving birth, and as you kindly mentioned, it is related to the sudden drop of the estrogen and progesterone or hormones of the pregnancy, and these hormones affecting the chemistry of the brain, mainly the neurotransmitters like dopamine, serotonin, and this can cause mood changes or even mental issues. The baby blues, it's just the symptoms started, as I said, in few days, and they go by themselves within 2 weeks.
So it doesn't last lots?
They don't last long,
Okay.
and they don't need medical help.
Okay.
But so they'll go anyway. So my advice to the ladies in the meantime is to set realistic. They consider the baby blues considered as induction adjustment or adjustment period, because as you said, the drop of hormones and the body is getting accustomed to not being pregnant anymore, and it's as I said, induction period or adjustment period for the mother, because now she's facing and building her confidence to face new challenges of care of a new baby. So my advice to her at that point is to set realistic goals and expectations for the daily task of care to herself and the baby. Secondly, ask and accept help from the family or friends. Connect to other new moms and even to partner or other family members. Avoid isolation.
So always support is very important.
All support is very important. Create time for herself for leisure and even have much rest as she can. And avoid alcohol, recreational drugs or caffeine that really worsen mood swings.
Now we talked about baby blues. I
Yeah.
want you to take me to the next stage.
The postpartum depression is a serious mental health issue affecting 1 in 7 mothers that could be mistaken for the baby blues.
So what are the differences? Tell me more about the symptoms.
Absolutely. The symptoms are, the difference is the symptoms are becoming more intense, long-lasting, and it's mainly causing, you find, like with baby blues, you find sadness, depressive mood, bursts or bouts of tearfulness for no good reason. She will have that really affecting her ability to bond and care for the baby and for herself and handling daily tasks. Even worse and more, she will start to develop, she will have lack of sleep, appetite problems, difficulty to focus and concentrate. She will have guilt and sense of hopelessness, worthlessness, and fear of that she's not a good mother. And this will reflect into panic attacks and anxiety and even anger rages, and intrusive thoughts and self-harming of herself and the baby. And if we reach at this point, it's a medical emergency. She should reach out for her obstetrician or call 999 or just drop into emergency room.
No, when we're talking about reaching that stage, is it possible to treat it in medication?
Definitely.
Even if she's breastfeeding?
Yes, because there are a variety of options,
Yeah.
or option variety for the treatment of postpartum depression. First of all, I urge her to reach early. And I tell you, some women say, okay, I'll wait and see if it is really which is which. But if she reaches early, because there are options, starting from talking therapy, which we call it psychotherapy. Talking therapy is a way that you find ways to cope with the situation. You'll solve the problems, respond more positively to the situation. So through talking, you'll find changing of thoughts and behavior. You find even the family coming, or the partner or the relationship therapy is also helpful. So one thing is talking.
Yeah.
Secondly, medication. It's antidepressant. Now, most of the antidepressant can be used during breastfeeding with little risk of side effects to the baby. So it's a matter of the doctor to choose which category of antidepressants or mood enhancer, and that maximize the treatment benefit for the mother and minimizes the risks to or side effects to the baby.
Okay. In terms of avoiding it, I know it's not that easy to avoid it, but is there things the woman can do to avoid it?
No, Lynn, I'm sorry for that. It can happen to any lady.
Is it linked to hormonal change?
Definitely hormonal change will the causes, but it can happen to anyone.
Okay.
So it's not preventable and not avoidable. But we can identify the lady who will need close support and treatment as early as possible. And as you said, the causes are not, there is no single cause. We don't know why it happens, but this research says it's the hormone, because that's obvious changes. So as I said, the acute, rapid drop of the hormones affecting the neurotransmitters and affecting the mood changes. Also, they found physical causes like diabetes or deficiency of the thyroid hormone, so underactive thyroid, or multiple sclerosis. And also there is some talk about oxytocin, which is the maternal hormone that's related to bonding to breastfeeding. And surprisingly, I'm not surprised so much about deficiency, anemia, vitamin D deficiencies, all vitamin Bs, zinc, magnesium, they weaken the maternal strength to cope with stresses, which are another cause is coping with stresses, stressful life plus new challenges of a baby who needs near constant interaction.
Mm-hmm.
So all these play together to trigger the postpartum depression.
Can a woman have a depression while she's pregnant?
Definitely.
Also like a hormone change?
Very good question, yeah. It's the postpartum depression is categorized as, yes, it's a mental illness that is as part of perinatal, it's a wider perinatal spectrum of perinatal mood and anxiety disorders. It can happen early during pregnancy and continue throughout up to 1 year after giving birth. So that's the period. Postpartum depression is serious. It's not only a few weeks after delivery. It can happen anytime, a few days, few weeks, few months, up to 1 year after giving birth.
And what about recovery? Does it take long to recover from it?
Recovery, if the lady ignores or waits until these symptoms of depression, which we can say that the symptoms again, that they wouldn't go away by themselves. On the contrary, it could end up turning into a chronic depressive disorder for the rest of her life.
Okay, so that's a really important point here. We're talking about like if you didn't get it, like if you didn't consider seeking help or support, it can carry on for years of your life. So it's really important. Take care of yourself as you taking care of your baby, of course, but also taking care of yourself is so important.
Of course, that it has an implication as well on her child, because the child will be affected, affecting the cognitive and behavioral development, and also in future the child will have problems at school, struggling with substance abuse and psychiatric illnesses themselves. Also, if we, apart from the chronic depressive disorders, if the situation can worsen because she will develop intrusive thoughts and compulsions, like checking the baby and safety and every now and then, and fears, develop fears and fear of the future and even self-harming thoughts. And that's serious, that's emergency, that needs medical help.
So for every woman who's watching us today, a message to take care of herself. There's nothing embarrassing to say like I'm not feeling well, or I'm feeling depressed, or I'm feeling sad. It's a huge shock happening to your body, and it's lots of changes in a very small period of time. And your hormones change, your body change, and it can be traumatic for some people, like the giving birth itself. From my personal experience, it wasn't easy. That's why I really want every woman who's watching us today to know you are not alone. It happened to everyone. Even if you didn't reach like the depression stage, it's okay to feel like you're a bit traumatized, let's say.
Absolutely. That's I'm glad that you are talking about your experience and trying to use it to empower women.
Of course,
that's very good.
That's the main reason of our episode today.
It's as you said, postpartum depression is not the fault of anyone, and that's why the lady feels that it's it's not her, it's not under her control that it happened. As I said, it can worsen. And reaching even some cases, we talked about the mental illness, the other mental illness, which is psychosis, which happens if we can talk about psychosis as well to warn the ladies.
If you can, please.
It happens, it's the serious mental health postpartum. It's very serious.
Can you tell us about it more, like symptoms? What happened?
It affecting 1 to 2 in 1,000 mothers, and as we said, the symptoms we mentioned before, but it's more worse, like a psychotic depression, mania, illusions, which is seeing, hearing, smelling, feeling things, they are not there. Delusions, false thoughts or beliefs, paranoid thoughts, something will come and harm her or her baby, confusion, acting out of character and loss of inhibition, and harming thoughts, harming herself and harming the
that's
baby.
an emergency case where you need to seek straight away.
Immediately should be in hospital among safety environment for herself and for the baby. She should, I don't know whether that's why the importance of having a support in the family or friends so they can look after these symptoms and monitor these symptoms, because sometimes the lady, they think it's normal to have this sadness or blues after delivery. They think it's part of the price they pay of being a mother, and they are not aware that the symptoms worsen. They feel that the inadequacy in themselves, not about the changes that happen to them. So it's a role of the friend or family to look after that, and once they have this, they gauge that there is worsening of the situation, you just to get help straight away, to call the obstetrician, to call the psychiatrist. There is emergency helpline on that with the NHS. So it's a must not to reach this stage.
I think
reaching early for treatment, as you mentioned, good point. Don't be embarrassed or secretive or feel it's you. It's not you.
Yeah, it can happen to anyone. During COVID, it's been more challenging. And I noticed even like before, it been like you've been able to go to mom's clubs, you've been able to mix. How can a woman take care of herself if we hit a lockdown again or COVID situation again? Sorry?
Hopefully not.
Hopefully not, but I've been through it and been very challenging. So from just like general advices, what do you think it's keys?
Yes, we can't talk about the lockdown now. It was one of the worst crisis pandemically, but it's just surrounding the lady. First of all, if she had the first time is shocking.
Yeah.
But there is a possibility that it will reoccur. Even, of course, the blues is very common, 80%. The postpartum depression can occur in 50%, and psychosis even. But if it recurred, it wouldn't be the shock like the previous time. And also she will empower herself and arm herself with a team of professionals, starting from obstetricians, psychiatrists, psychologists, everyone, and has got hotlines so she can call straight away. And also surrounding herself with a family and friends. So and there is postpartum depression support international group. So that's absolutely, even through the internet. And if somebody wants to gauge what's happening to her, we do screening, like during preconceptional or early booking. That's our job. But that's already, she's got pregnant, she has got no information. So it's our job to identify, but it's too late. It's better to empower her with information. That's what you do. So there is, over the internet, there is Edinburgh Post-Partum Depression Scale. It's a form. She can fill out this form and score herself. And if she scored high, then she will reach out for the services or the emergency service or the medical service, not necessarily. So the most important thing to have treatment as early as possible. And the treatment could take several months.
Yeah. Each case
whatever
is
it takes. Yeah. So she should be persistent, shouldn't be frustrated. She should comply with the plan of care, taking the prescribed medication as should be, follow the psychotherapy, don't drop any psychotherapy session, and it's treatable disease. It's treatable disease.
Yeah. Well, one of the main reasons I want you to talk about mental health was we always try to do our best and we always have a guilt feeling. No matter how good women in general, no matter how good we do, we always have like, am I doing good enough? Am I a good mom? Am I? So it's just a message for you. You are doing amazingly well. And don't compare yourself to other people, because
Never.
each journey is different. The only thing that I really insist on, like, please take care of yourself and of your mental health. And if you are not feeling well, it's okay. It's not only you, and it's all over the world. There are women who are passing through the same experience as you. At the end of our episode, I don't want it to finish, Dr. Nadia. I want you to, the final message I want it to be from you to every lady who's watching us today.
Yes, the take-home message, if I can say. First of all, it's not her fault. It's nobody's fault. And there is no cause for it. And she shouldn't suffer in silence. Should empower herself with knowledge and reach out for medical treatment as soon as possible, because it's treatable. Don't feel embarrassed. Don't be secretive or hide, and you feel that it's all about you and inadequacy and fear of judged to be a mother. No. Okay, so that's the main message. Take care of yourself and empower yourself, support yourself with medical professionals. Always, if you have got any previous, not you, I'm talking generally, if there is a previous past history of depression or blues or psychosis in herself or the family, or even already pre-existing bipolar disorder, schizophrenia, this should be under medical surveillance, as soon as possible. We implement a plan of care for her. So there's nothing, mental illness is like any illness. It happens with these things that we mentioned. It's a complication of pregnancy. It's a mental illness, and the illness that can be treated with good medical hands. Just reach out as soon as possible and timely, and don't be late.
As we look after our physical health, we should really always take care of our mental health. And when we say like mental health, we are not talking about like, oh, I'm crazy, or I will be judged, or it's embarrassing, or whatever. It's hand in hand, both of them.
Correct. Yeah, agree.
Thank you so much for being with me today.
It's
a pleasure having you.
Thank you so much.
And I hope even if we benefit one lady watching us, I feel like my message being received. Thank you so much.
You're more than welcome. Thank you very much, Lynn, for having me. Thank you.
See you next week in a new episode from London with Love with me, Lynn Clive, on ALB UK TV. Stay safe.